I appreciate it. Thank you both. And I want to open up the conversation in just a minute for other experiences or questions or comments on Medicare. But I wanted to close with some just an overview. When Congress passed Medicare Part D, they made a pact with seniors who were desperate for a plan to make medicine affordable. Nobody should have to decide between food and medicine. But the plan that George Bush and Frank Wolf produced broke the promise that was made to seniors, and they did it for the worst of reasons, because they wanted to reward their friends and campaign contributors in HMOs and drug companies. After 26 years in Washington, Frank Wolf is clearly part of the problem, and he needs to be held accountable. Medicare Part D is just, however, the tip of the iceberg. Over the past several years, our healthcare crisis has gotten worse and worse. Health insurance premiums have risen 5 times faster than inflation in the last 5 years, and 6 million more Americans are uninsured today than they were 10 years ago. Those of us with insurance often have HMOs dictating what kinds of care we can receive, and we really can't count on quality care. All the while, drug companies and HMOs are making money with our tax dollars. Today, I'm unveiling a set of priority for health care that works for all Americans. We can't solve this health care crisis overnight, or even in the next Congress. But there are many common sense steps we can take to control costs, cure critical diseases, and protect patient privacy. Along with giving Medicare the power to save by negotiating the best prices for prescription drugs, today I'm calling for savings by investing in the research and training that we need to make our healthcare system more efficient and more quality-oriented. Currently, research shows that patients only get the correct care about half the time, 50-50 chance. It's not good enough. We can't waste resources on unnecessary tests and procedures, and patients deserve the best treatment. We've got to fix that. Along with improved information technology that we need to streamline care, we also have to reform our patient privacy laws to protect patients' personal information from falling into the wrong hands. And we can also hold the FDA accountable for patient safety while eliminating the backlog that is keeping more affordable medicine off the market. The final proposal I want to make today is more personal. I have a friend who suffered from ALS, who recently died. It's known as Lou Gehrig's disease, making me believe more strongly than ever that we have got to invest in the stem cell research that holds the best promise for curing this illness and many other terrible diseases like diabetes, Parkinson's, and spinal cord injuries. I know that we have the capacity to make our healthcare system work for all Americans. I came of age when John F. Kennedy inspired us to believe that no matter how difficult the problem, no matter what the odds, Americans can achieve a brighter future by working together. But we can only build that future with leaders who know we can do better, who know how to do better, and who haven't been in Washington so long that they've forgotten that the future lies in ideas. It's time to say no more failures, no more excuses. On Election Day, November 7th, we are going to change Washington and hold politicians accountable. Because the only way to change Washington is to change the people we send there. Thank you. people having issues with Medicare Part D they'd like to share?
Well, I do. I've been looking for a place to complain.
Well, well, go for it.
We signed up for the Plan D with a lot of trepidation, all the rules that they wrote into this program. Well, I hit the cliff or the donut hole by the 1st of May, and now I've hit catastrophic by October 1st. And I looked at how much has been paid, I have paid out of pocket
Yes.
compared to last year when I had just about the same kind of drug needs. And I had the Medigap
Yes.
plan that has the drug prescription coverage. Well, I spent less than $2,000 out of pocket last year, and now I'm over $3,000,
Wow.
right?
Wow.
Because
Yeah.
when you
The
hit
whole-
catastrophic, you've already spent over $3,000.
Right,
Yeah.
right.
And I've got 3 more months to go in this year, and then next year I can do it again. And, one of the points that you brought up about having to pay premiums all the while that we're in this quote donut hole, that got under my skin too.
Yeah, I can understand that. Thank you. Well, guys, I'm glad here today. I want you to think you're not venting for nothing, because the reason that we're having this conversation is because I believe members of Congress ought to be hearing these problems so that
Yes,
they can
they
get
ought
to
to
work
be.
on fixing them. And I want to thank you for sharing
Yeah.
it, because that's my plan.
Thank you.
Thank you. Yes.
I just want to make a suggestion.
Yes.
I think there has to be some negative campaigning on your part, and one of the things you could have as people, just like our lady there in front, speak up the fact that Frank Wolf does not have the constituent services that everybody seems to think that he has, because that was a point that was brought forward in that Washington Post article that was also in our Winchester paper
Yes.
that said that he can still win because of his good constituent services. I think you may need to bring that forward as one in that last stage that you're in, because it's something that needs to be dispelled.
Well, I thank you, and I think what we're hearing is that it doesn't take me to bring it forward, because you all are dissatisfied and are bringing it forward yourselves. And constituent service is the basic part of a Congress member's job, and they also, it's not enough even when they do that well, because they've got to be taking care of the bigger picture. Thank you.